Hello, and welcome to the Keep It Real Health Education series. In this episode, we're going to talk about increasing your exercise program and how to work with injuries. My name is Dale Collins, and I'll be your host. I'm an exercise physiologist, strength coach, writer, speaker, and researcher with over 2 decades of experience in the fitness industry. I have a master's degree in exercise physiology and biochemistry, and I'm a doctoral candidate in health and human performance. When designing an exercise program, there's two major things that we need to look at to determine exactly what components go into the program and what are going to be the exercises, sets, repetitions, and actual timing of the exercise program. The first one are basic fitness protocols, meaning exercise endurance, muscular strength, flexibility. If you're not addressing these basic protocols, then what's going to happen is that exercise program isn't going to actually cause much of a physiological change. Layered on top of that, we need your specific goals. So whether your goal is to increase muscle mass, improve your balance, fully recover from an injury, all of these things have to be looked at to truly design an exercise program that's specific to you. You can purchase exercise programs, but a lot of times they'll be lacking in one or multiple areas because they either do not meet basic physiological needs or they fail to address your specific goals. To help you understand this, for instance, if your goal was to fully rehabilitate from an injury, one of the biggest issues we see is an imbalance from one side to the other. In this case, your program needs to include a lot of single arm, single leg exercises with body weight and in addition to free weights to work on building up that balance between the two sides. You hear a lot of people that state an injury came back around. No, you didn't fall or get hurt the same way twice. Most times if an injury comes back around, it's because you failed to balance out the two sides. If you don't balance the two sides back out after an injury, you have a compensation pattern. And the number one predictor of an injury is a prior injury. So balancing out the two sides left and right is a huge issue after you've had an injury. If your goal is to improve your balance, your fitness program needs to include single leg or single arm exercises with body weight and some sort of instability. The only way to improve your balance is we have to put you slightly off balance, but that needs to be done in a correct fashion. Meaning we don't want you just in the middle of the room on something very unstable like ice because your risk of an injury really goes up. We want to slowly progress that instability, but in a safe manner. If your goal is to improve your overall strength, then we need an exercise program that includes additional weight and maybe increasing weight every week or in a specific pattern to work on improving strength without risking an injury. In this case, you can definitely use machines starting out, but to truly gain overall strength in a functional pattern, meaning the way you're going to use it, you really need to work up to more advanced free weight exercises. If your goal is to reduce the risk of cardiovascular disease, then you need a program that includes heart rate based cardiovascular exercises, meaning these target your specific heart rate based on the physical condition you're at right now and will slowly increase to work on decreasing your resting heart rate and improving your cardiovascular strength and endurance. And then if we're talking sport specific, we need to make sure that those strength-based movement patterns mimic the sport that you're trying to participate in. So those strength programs need to actually help you for specific movement patterns to improve your sport. These are just several examples of what program design should look like based on your specific goals. So to dig into a little bit more detail, if we're designing a program for strength, for instance, if we take deadlifts, we would do 5 sets of 5 repetitions, usually 3 times a week, starting out with a set weight. So you notice as we move up to week 2, week 3, week 4, I'm not changing the sets of reps, but I'm always adding weight because the goal is to get you stronger. In order to build strength, we want less repetitions and adding more weight on a consistent basis, usually not more than 10% of the total weight per week. So in this case, from week 1 to week 4, we've increased 30 pounds for all 5 sets of 5 repetitions. A slower way to build strength, especially in somebody who maybe is very deconditioned, in someone who is starting from a real baseline, is to start off with 3 sets of 10. This is a really good overall rep and set section to basically work on building a little bit of strength, a little bit of muscle endurance. So for instance, we'd start this at 135 pounds. Week 2, we'd still stick with 3 sets, but we'd go up to 12 repetitions, still at the 135 pounds. Week 3, we would increase the repetitions to sets of 15, still with the same weight, still 3 sets. When you look at week 4, you see we've decreased the repetitions back down to 10, but we've increased the weight. So throughout this month, we've started with 3 sets of 10, ended with 3 sets of 10, but we've bumped up the weight. This is a slower way to increase strength. For a lot of people, especially as you age, this seems to be a little bit better program. We are building strength, but we're not getting real sore. We're not really pushing the body too much, just enough to build strength, but not enough to risk an injury. When we start talking about high intensity, then we're doing basically rounds of multiple exercises, one right after the other with no breaks in between. High intensity, we're still doing strength training. We're adding things in that are going to increase the heart rate, but still work the muscles. So throughout this, we can slowly add weight as you get stronger, but we're making sure you're doing the deadlifts, then the box jumps, then the push-ups, and the tricep dips. We're forcing you to continue working with that heart rate elevated. So you're going to build strength, but you will also work on improving cardiovascular fitness levels. So it's one of the reasons a lot of people enjoy the high intensity. You're doing strength and cardio at the same time. You're getting the benefits of both, but it can be very challenging, especially starting out. Usually I don't recommend high intensity unless somebody has a good basis of strength. So an absolute beginner, we'll usually start them lower. We'll start them easier, not quite throwing them into the high intensity right off the get-go, to make sure that they can do this without the risk of injury. And then advancing an exercise. So in this case, we start with a standard deadlift, and then we go up to single leg. So by splitting the legs, making each side work independently, yes, we're using a lot less weight, but you're actually working a lot more musculature with the single leg deadlift. So you're working a lot of supporting, stabilizing musculature. And what you're trying to do is see if there's any imbalance from left side to right side. Is there a lack of mobility, a lack of strength, a lack of stability? The only way to really work on stability is to separate out the sides and looking at that strength imbalance if there is any. This is a case where if someone's had a prior injury, we might start with standard deadlift, but we would either switch to single leg or even add single leg in, continue with the deadlift in the slow strength progression, but just simply layer in the single leg to work on any imbalances. Now, in reality, what will your exercise program look like? It can actually be a mix. So when you notice in this case, we're doing the heavier strength pattern for the standard deadlift. We're doing a slower strength pattern for the single leg deadlift. We're doing a little bit slower pattern for the walking lunges. We're adding single leg bridges, side plank with hip dip. We're adding regular plank. So each exercise the actual protocols are going to vary a little bit based on your goals, your needs, your prior injuries, and that's okay. When we talk about specific programs for individuals, the reality is you're not going to have every set, rep, and exercise look the same as far as protocols. They're going to vary quite a bit. Certain things will improve faster than others, meaning you notice the side plank with hip dip, that one progresses very slow. This is a lot smaller muscle group. It's going to fatigue faster. So we don't increase the progression on that fast when compared to something like walking lunges or even a single leg deadlift where we'll ramp it up quite a bit. So each exercise will vary based on the individual, based on your needs, based on your goals. When working with people, one of the biggest challenges we run into is the difference between pain and discomfort. So I like this pain scale because a lot of times people say, well, this hurts or that hurts. And we really need to differentiate that. Something that is discomfort is different than pain. Usually my protocol is nothing above a 4. So if you do an exercise and it feels like a 4 on your scale of 1 to 10, you need to stop. We need to make some adjustments. It's not the right exercise for you. For every person, exercises will feel different. And same thing with stretches. I tell people not every exercise works for everybody. Not every stretch works for everybody. The key is figuring out what is the best for you, the individual. So 1 through 4, this is discomfort. That means as soon as you stop the exercise, that discomfort is going to go away. Once you get to pain, that feeling or that number does not go away when you stop the exercise, and that's not a good thing. Discomfort, your body can recover from it. Give it a little bit of rest, it'll be fine. Pain is your body trying to tell you something. You really need to listen. You really need to back off, either decrease the weight, decrease the sets and reps, or you may need to totally change the exercise. This exercise might not be right for you. You may need to work up to that exercise, or in some cases, I will totally scrap that exercise for that individual, meaning we will never even attempt it again because it's not the right exercise for that person. So feel what's going on with your body. If it's mild discomfort, fine. 1 through 4, okay. If it's anything more than that, no. You need to question the exercise. You need to question why you're doing what you're doing. This is meant to improve you, not to cause you pain. The old no pain, no gain, no, I'm sorry, especially as we age, that does not work. Pain is your body trying to tell you something. You need to listen. You need to make adjustments. Usually I have people come to me after an injury, and everybody seems to think that they're odd person out because they got injured. And quite frankly, injuries are common. Injuries are normal. It happens to everybody. One of the big issues is we've really changed up how we look at certain injuries and what we do. Most important thing is what you do after the injury. So the traditional method is looking at rest, ice, compression, and elevation. But some of these protocols have changed. Traditionally, after an injury, you'll be told to rest, meaning do nothing, try not to put any weight on the injured area. And while rest can actually make you feel better, the problem is rest is actually not the best thing for the injury. A lot of times we're going to be told don't do anything. So we'll get into the right way to do things after we talk about traditional methods. Ice is going to be the best way to help reduce inflammation. So if you have an inflammation, especially across the joint or in lower back, pinching on a nerve, ice is going to be one of the best ways of doing it. Obviously, you don't want to put the ice directly up against the skin. The goal is not to freeze the skin, just to reduce the swelling in the area. Gentle compression can actually help prevent swelling and actually speed up healing. The key is making sure it's not too tight. I've seen people take things like a stretchy ACE bandage and wrap the area so tight you're basically cutting off blood flow. That does not help. You're actually causing more injury at that point. The goal is a little bit of compression. That's where a lot of those slip-on neoprene sleeves seem to work the best. Little bit of compression just to help reduce the swelling in the area. And the goal of elevation is once again to help reduce swelling. By having the body part above the heart, basically what's going to happen is you're going to have less swelling just because of gravity is going to try to limit the amount of blood and fluid going to that injured area. So once again, you notice the ice, the compression, the elevation, all these are means to reduce swelling. Simply for the fact that swelling in caveman times was great. It brought a lot of white blood cells to the area to help fight off disease. But especially in closed skin contact, swelling usually doesn't help anymore. We have a lot of more modern techniques that can help you a lot more, so we don't focus on this any longer. So we use what's called active recovery. This is more sports medicine after the injury. We talk about movement. We talk about analgesia, which is basically pain relief or pain treatment. We talk about specific treatment for the areas, and then exercise or movement. So a big thing that's changed over the years is after an injury, we actually want to get you up and moving a lot faster. We really see this post-surgery, especially in big things like knee replacements, hip replacements. The goal is actually to get the patient up and moving within less than 24 hours after the surgery. And the major reason for this, while resting helps you feel better, it actually does not help the injured area. And what they've found is the old school method of having you rest for a week or two in the hospital after having a surgery actually caused more damage than the surgery itself. That's why you see those surgeries, yeah, they want to get the person up and moving. A big part of this is we want to move you through the range of motion without pain. This is going to actually help move lymph throughout the body. It's actually going to help increase blood flow throughout the body and especially to the injured area. That's because blood flow provides oxygen and nutrients to actually help the body recover. We've got to get that blood flow. So sitting doing nothing does not provide significant blood flow to actually help the area. So we want you up and moving. We don't want to see a loss of muscle mass. We don't want to see a loss of range of motion. Do as much as you can without pain is the new standard. It is important to note that mild pain management, even over the counter, can be very important. So anti-inflammatories, things like Motrin, ibuprofen, Aleve, Advil, all of these things can help actually reduce inflammation and can actually allow you to get up and around without as much discomfort. So is this a right way to go? Yes, within standards, within the manufacturer's recommendations on how much you should take and your doctor's recommendations. So reducing the amount of pain is going to make it a lot easier to get up and move, get out and do things. Believe it or not, walking after a back injury is one of the best things for a back injury, which seems counterintuitive, but it actually helps the range of motion. It helps keep your body from tightening up, helps your body recover faster. So if you need a little bit of pain management after an injury, that's fine. But once again, you got to move. Treatment after an injury. This is going to be very specific to the injury. And this can be anything from taping to acupuncture to physical therapy. A lot of times we'll see after a mild injury, we may do something like a compression sleeve, like a knee brace. That is something where we can get you up, get you moving, provide more support around that joint so that you can get out and do things without the risk of another injury or exacerbating the current injury. So treatment is very important. You need to make sure you're treating the injury. You need to make sure you're doing what's correct for the injury to, number one, limit your risk of re-injury. Number two, get you up and moving and back to full movement and back to exercise as quickly as possible. One quick note on this. Things like knee braces, elbow braces, these are meant to be temporary. This is not, if you have a knee problem, you should wear a knee brace for the rest of your life. They are meant to provide additional support until you get strong enough so that you do not need one. And this ties into the next part of the exercise and even back to when we first started about a rehab or an exercise program for you. Your exercise program needs to address that issue. If you're wearing braces all the time, your exercise program is not correct. Your exercise program is actually not helping you fully recover from that previous injury, and it's something that needs to be addressed. And then back to exercise. You need to move. So you may need to start out very easy. You may need to start out with no weight. Now, does this mean you're going back to the very beginning when you first start exercising? No. As we kind of talked about in that reality of an exercise program, it may mean if you have a knee injury, all your upper body exercises stay the same as right before you were injured. And you may even work on upper body a bit more. We just need to adjust some of the lower body exercises for the current state of your injury and state of the muscles and range of motion across specific joints. Or vice versa, your lower body might stay the same. We need to adjust the upper body. So you should be exercising. One of the interesting things they found is people that injured one leg or one arm, if they exercise the other side, the injured arm, because of the increase in blood flow, actually recovered faster. We saw increases in strength in the injured side by only working the non-injured side. So a lot of those benefits do carry over, that increased blood flow, the nutrients, things like that. So getting out and exercising within acceptable range of motion without pain, not trying to really push on the injured area, work it through the range of motion, slowly add weight, slowly and progressively build back up. That's going to be one of the biggest keys after an injury.